Far beyond witches and wizards is the root cause of health problem of many in Africa. Seek professional advice concerning that your health matter.
Join Dr. Save a Life Foundation.
You and Your Health with Dr. Richard Okoye. Now on AIT every Monday by 9:30 a.m.
Hello, I usually count it a pleasure and indeed a privilege for us to be in position to be together through this particular medium, You and Your Health. You and Your Health is a program sponsored by Dr. Save a Life Foundation, a non-governmental organization with a clear vision of giving total health to the people of Africa through the power of knowledge. And today's edition is going to be so special as we started last week, where we said, okay, having been able to put it like a lecture class or a teaching, so many people said, wow, I'm now a medical student. That's interesting. But medical students are also subject to writing exam, and part of the ways they get well acquainted with the subject is through interaction. And that's why we're opening up a chapter right now which states, can we talk a little about this by you getting the question in, and let's together be able just to look at it as it will be able to benefit all. Listen to me. In a number of occasions, people do say, this is my problem, peculiarizing or personalizing a particular health or challenge. No. The Bible declares something. It said that the problem you are passing through is common to all men. It's common to all men. But God will not suffer you beyond that you are able. But in the midst of it, you will make a way of escape. So what you are suffering, others are suffering. So whatever you send forth here, we can read it openly. Be that as it may, you can go anonymous, because someone else passing through the same can also benefit. And that's why in today's edition, we're going to look at a number of questions people sent in. Let's be able just to start talking as he referred to us one-on-one. And interestingly, I have a number of them, and some I will be in position to select because of some issues very striking in them that we need to be in position to talk about. Okay, let's just start by looking at this very first question. Dr. Richard Okoye, God bless you for the wonderful work you are doing in this country. Thank you very much. Doctor, I match poison, and for 4 years now, I can't walk or go anywhere. Few days ago, a friend sent me a video of a man and a woman who can walk before. And I wept seeing them walking. The woman was even exercising. How can I come out of this? This is a very interesting question. And she is telling us something here, that it happened to find herself in an ugly scenario where she matched poison. How many people you know that have matched poison in this country? Or your friend or your loved one having matched poison? That is the reason why they are bedridden. That is the reason why they are having one challenge or the other. That's the reason why they are losing their job because of sickness. I want you to encourage each and every one of them right now to tune into this registration. I will be right back as we analyze the experience of this our sister vis-a-vis the way out of it. Stay tuned. I'll be right back.
You and Your Health with Dr. Richard Okoye. Now on AIT every Monday by 9:30 a.m.
Welcome back. You are still on You and Your Health. I remain your friend, Dr. Richard Okoye, the president of Dr. Save a Life Foundation, a non-governmental organization, very clear. A vision that through the power of knowledge, that things can turn around health-wise in aspect of the well-being of Africans. And starting from home is a fantastic experience. We have a vision that by the year 2025, Nigerian life expectancy will move. Come on, I share it as a confidence that you gonna get it How possible will be the question that will remain in the heart of people until we start rolling out some things couple of months to come now. Then you will know it's a reality that ignorance has been the fundamental cause of our health disaster. Facility, a secondary subject. We also will get to that. Now, looking at today's edition, we said, come on, let us make it more interactive. This number right here, send in a question regarding your health, regarding someone else, regarding whosoever. Let's be able to look at it together, all right? By so doing, that we could be able to fashion out something that when we all get to know what our doctor knows, perhaps our academic background, family background, and economic background may not have privileges to know those things, you will get it right here in your own language. A woman sent a text stating that she matched poison, all right? Oh my goodness, that very poison must be so powerful. She matched poison, and that very poison made her not to be able to work. And she can't go anywhere. And that has been for 4 years. You can imagine depression, you can imagine some obesity problem and all that, hypertension and all those things associated with sedentary lifestyle. Of course, it will also come. She didn't tell us all that. But she said that it is as a result of poison she matched. And let's address that poison aspect well. It found out that we were all grown up. And in our traditional way of life, traditional society, and the narrative we share from the beginning, we all believe that if something happened to you, health-wise, it must have been your enemy. It must have been one god or gods, responsible for that. You get what I mean? So on that very accord, we carry the same mindset and also reach out to our religious organization, be you Christian, be you Muslim, be you whatever. There's something that will always tell you. Even in the church today, Satan has become the chairman of every occasion. That whatever happens to you in your health, it must be one demon, it must be one Satan, it must be one enemy. And we are saying the hour has come for the truth to be known. Listen to me. That story will end in our time because many people will get to know. That's why I call every religious leader to be part of this particular mission and be able to understand that the men of Issachar had understanding of time and they were able to change their message. Enough of this demon attack, witches and wizards, even in the life of people you say Christ have redeemed. Something is wrong. The Lord said, my people are destroyed for lack of knowledge. Now, madam, and all the people that are having one knee problem, one hip problem, bone related, back pain, all manner of pain, listen to me. Why we do not undermine any satanic manipulation to them that don't know their God, we want to establish the fact that poison you match is not responsible for you not being able to work. I want to tell you that what you are happening, what is suffering, which you saw in the life of those two people you say you saw. I think we will play the video here so that you will be able to see that most of those things you call poison, they are not poison. No, they are not poison. It could be as a result of arthritis, it could be rheumatoid arthritis, it could be osteoarthritis, but you need to get to the hospital and be properly evaluated. Let's look at that very video. I think I have one of such this thing here. This is the lady that she saw and said that this lady who couldn't walk this way could not be in position to exercise. All right? But in her testimony, and I will tell you, if you listen to her testimony full, she never matched any poison, but she found herself in this way. I will tell you. And if you look at this second one, this is the man also, that video sent to her, and this man was crippled, as it were, not able to work, and also in his testimony, there was nothing like poison that he matched poison for which this happened. What you see these people suffer is what is called osteoarthritis. Arthritis is simply inflammation of one or two joints. There are different types of arthritis, which could be rheumatoid arthritis, those of autoimmune, and also the one that is called osteoarthritis that is very much common among most of our elderly moms and dad. You see a number of them, they can't walk, they use walking stick, sometimes you see the leg bend, as you can see here. Such could happen. There's also a kind of a bow leg which is called blunt disease. It happens very common, where you see a small boy or a small girl, the leg will just bow. All right, so such situation could happen, and I will have, if I have the time, I will be able to also tell you about the treatment of blunt disease. Those medical one, you see the leg will just bow, but they're still young. So that's the one you can see when they are younger. And in most elderly ones, you see what is called osteoarthritis, except in a number of occasions, you can also have rheumatoid arthritis, which in that case, every small joint and all the joints, all of them will be paining the person. So that one involves multiple joints. But most osteoarthritis affect most of the knee and also the hip and some other dependable areas. Okay, I would like you to stay tuned, call your friends, while we now look at the pathophysiology or pathogenesis of how these people were looking normal originally, and all of a sudden you see the legs start bowing, and all of a sudden you see the woman that sent this, they're saying, for 4 years I couldn't be in position to walk again. I want you to stay tuned, and when I come back, we will look at how these things happen, and if there is any hope, we can also share it as well. Stay tuned, I'll be right back.
You and your health with Dr. Richard Okoye.
I'm more than 50, but God, in His mercy and grace, today I can breastfeed.
I never dreamt in my life to be in India, neither enter plane before I died at the age of 70. My vote of thanks to doctor saving a life. I'm very happy with them. They've not revived my life again, no matter the age. Now I feel I can live a little longer than I could have lived.
You and your health with Dr. Richard Okoye. Now on AIT every Monday by 9:30 a.m.
Welcome back. You are still on You and Your Health, a program sponsored by Dr. Save a Life Foundation. We have a vision of bringing this very medical big grammar in your own language. That is the mission God gave us as an assignment, to decode medical terminology in a common man's language. And today we will look at arthritis, why it affects people, why it happened. Someone sent us a text message emphasizing that it was as a result of poison she matched that she couldn't be in position to walk again, until she saw the testimony of some other person walking after being in her relative state. Okay, so today we are going to look at arthritis, and osteoarthritis is the commonest cause, and I want to show you something here. Now, watch this thing very, very well, because it will help us to have understanding. This is a healthy joint. When you look at joint is where two bones meet. Other things, tendons and others, will be in position to fortify them well. But I want to tell you something. This particular joint, if you see this very bone, is the femur. There's the downside here, right? And then you have the hip bone. Two of them articulate. When you talk about articulation, just like you see trailer, you know, the front one will be dragging the back one, so you call it articulated vehicle. Okay? So this is an articulation that two of them meet here, and they have to be firm, they have to be together, they have to be rubbing on each other. And if to, of course, looking at the tire, if the vehicle tire is rubbing over the time it will run out. All right, so but something happened that, despite the fact that these two are meeting together and you are moving all the time, you are moving, most people never had any pain all through their lifetime. How did God achieve such a powerful feat? And I will tell you how it happened. If you want these two, now looking at this very interesting, all right, here now, you see that towards the ending of this particular place, you have a shiny glass-like material that covered here, all right? Same also cover the inner side of the opposite bone. That is to say, that glass, a piece of glass, there's no blood vessel in it. It doesn't take any pain. It doesn't have anything in it. It's just a piece of glass, just covered it. That is what you call biscuit bone in most of the goat, cow, and all those joints you do eat. You call it biscuit bone. Most of us like it. It doesn't mean that as you are eating biscuit bone, your body will be strong. No, that biscuit bone, it doesn't have any nutrient in it. It's just like a piece of glass. Why did God have to use it to cover this? Now, listen to me. The covering of this is to enable the two surfaces, since they don't have any pain sensation, no nerve in them, so you can be rubbing on each other and you are making move, you are running, you are walking, nothing. All right? Nothing will be in position to pain you. But in addition to this protection, listen, it is waterproof because it doesn't allow fluid to move from the body into that place. All right? And something also happened that between these very two bones, God injected a fluid. If you go to slaughter, where they kill cow, when they are doing the cow leg, you will see that when they cut the joint of the cow leg, there's a fluid that usually come out. That very fluid is called synovial fluid, and the same in cow is also same in human being. And what happened is that God injected that very grease, as it were, right inside there, and that very water got trapped right in between them. It doesn't go out because this is waterproof. The body can't absorb it, so it will remain there. So the essence is to lubricate that very surface as you are walking painlessly, as you are jogging painlessly. Okay, that is how it happens. I call it healthy joints, when the joints are healthy. Now, check out what happened. Over the time in the journey of life, something may go wrong. A number of them seem to be genetic in nature. What I mean genetic in the sense that it tends to run even in families. All right? So now, this very joint will now be in position to be, when osteoarthritis sets in, it will start damaging that very cartilage. Did you hear me? That very cartilage, that biscuit bone, you will start chopping off the biscuit bone gradually, and over the time of chopping it, you find that place now, the water that is, that very fluid, that synovial fluid, can easily be absorbed by the body. That absorption will make that place, you see, the person will be, on attempt to move the leg, you will hear it, just like a rusted heat joint of the door. You see, it will just be making noise, crack, boom. It's because that place is getting dried. In addition to that, movement will start getting a little bit painful, and sometimes you will get the place swollen because the fluid in the body can easily have access into it, and you see the joint got swollen also. So this will continue to happen, but over time, you will now have this very joint. If this cartilage is eating up this way, if it is eating this way, you see the person will now have a bow leg. All right? If you also eating up the other one, you will now have K leg. So all depends on how this has damaged. And when something like this happens, it's unfortunate. Most people will depend on painkillers. Most of the painkillers under the group of non-steroidal anti-inflammatory drugs, most of them, which is being used to relieve this very pain, may end up causing ulcer also. So that's why you see most of them having arthritis or pain-related thing will also later complain of ulcer. Some can even abuse the drug that it can affect the kidney. So if you are on such painkiller, be very careful. Take it with food, and if need be, and also to protect your kidney. But in a situation like this, there is nothing, not the exercise, not the massage, not the issue of physiotherapy. At this very point in time, it's already a very bad scenario. All right. So that's exactly why you see the man walking in that very way, and because of the issue of arthritis. And you see some will have K-leg, you see all manner of things. But let me point out here, you can see some children, not even up to 5 years, even some will be born with it, some will be in the process of growth, and you see them start getting bow leg. That is not as a result of arthritis. It is what is called blunt disease, and that is because this side of their bone is growing faster than the inner side. So most of the time they see their particular disease start getting this thing. So that's why that can be surgically corrected also. But best time when he has minimal osteophytic changes within the joint. That's when he must have reached at least the age of 15 and all that, you know, except when he becomes so ugly that so you can do a corrective osteotomy. But in a situation like this, just like she said, she saw these people now walking and she found herself in pain 24 hours. That's what is called knee replacement. Knee replacement is done all over the world right now, and also the latest edition of it is also what is called painless and minimal stitch knee replacement surgery. That is the type that doesn't allow the cutting of the quadricep muscle that actually being the order of the day. It is also surgically faster, and by reason of that, it helps to maintain the patient not to be in position to sleep. So the spinal injection time bell or epidural injection time bell can also be maximized. So that's exactly what you see. So my sister, can we at this very point in time, I know you have prayed, I know you have bound a lot of witches and wizards as assumed. Can we now start from the known before we go to the unknown? Go to the hospital where you are. Right there, let them properly evaluate you. You do an X-ray first. The X-ray will show whether there is anything like osteoarthritis, a damage to that, and if that is available, option from the drugs. If the drugs not responding, then you can be in position to do knee replacement procedure. Even this one, as a matter of fact, right now you can do what is called anatomical hip replacement. Anatomical hip replacement involves that because it doesn't got the matrix or the bone damaged in most of the cases, so even a young person can still grow even after the procedure. So a lot of things God has been able to provide in our time, but do not go and be following demons and attack and all those kind of things. Can't you just go to hospital? Go to the hospital. Let your doctor advise you first. The advice of your doctor will go a long way to determine if you will not say, oh, they have done all the things they could do and nothing is working. Then we can be in position to clear the negative powers if existing in your matter. But to the best of my knowledge, what you may have right now is osteoarthritis. Go to the hospital and stop giving glory to that devil that may not be existing in your life as a child of God.
You and your health with Dr. Richard Okoye. You and your health with Dr. Richard Okoye. Now on AIT every Monday by 9:30 a.m.
Welcome back. I do hope that has actually made sense to all. Let us quickly look at this very next question. Very interesting also. Dr. Sevilla, you may not know what God is using you to do in our generation. I pray he strengthen you and encourage you. Thank you very much. But I will also point out here, you know, a lot of people always encourage me, call and say, Dr. Okoye, you are doing well. That's good. I appreciate it. But you also encourage us in any way you can to keep this very program on air. You know, we have a form of blessing people here, which is not a bad thing. You know, God bless you. But if a hungry man, if the man is hungry, I beg, what that person needs is food. He needs food. So we should be in position to, anything you have to be in position to support this program, do that also. But let's look at his question. I appreciate that, but I needed to appoint it because I've been receiving baskets of them. All right. So he now said, I have two major problems. I've been suffering from pile, sometimes called hemorrhoid. No, it's not hemorrhoid. Hemorrhoid for 10 years now. The second is I also have kidney stone. Most time the doctor say drink water. Is there no permanent solution to this? Interesting. This is a very, very interesting one because many people have what is called pile, otherwise also called hemorrhoid. Or not hemorrhoid as he mentioned, hemorrhoid. And also, they have issue that has to be with rectal prolapse, and may have issue with an rectal fistula or anal fistula. The one that some people will go to toilet, the thing will come out, they have to push it back. Some will see some pus coming out, and some will also see blood when they go to. So most time they miss it altogether. Some may have very severe pain while trying to defecate. Because of our time, we will continue in this very section next week, when we will be able to analyze all of them. Same station next week. Don't forget, 9:30 a.m. Monday morning. See you again.